So even though I've been trained to do a traditional facelift, that's the way I was taught.
Wake Deep Plane Facelift, a much less invasive procedure.
A little neck lift.
We're doing Ponytail.
The vertical restore, which is a combination of a deep plane approach.
Hi. Have you guys been told that you really should not get any kind of facelift unless it's a deep plane facelift, or that this vertical restore facelift or ponytail lift are the best kind of facelift and you should ask for that? Have you heard about other kind of branded facelifts and why you should get this one instead of another? This is sort of a pet peeve I have in my own specialty, and I wanted to talk about the importance of understanding what a facelift really is and why it is absolutely not a one-size-fits-all operation. Hi everybody, I'm Dr. Jonathan Zelken. I'm a board-certified plastic surgeon in Newport Beach, California, specialized in facelifts. And I want to talk about specifically why everybody asks me, can I have a deep plane facelift? I heard it's the best, and what my response is when people say it. So I think in the past 10 years, the deep plane facelift has gained a ton of popularity, and really what this means is that rather than lifting the skin up off of the deeper structures of the face, sort of tightening that deeper structures and then tailoring the skin back, what you're doing with a deep plane facelift is you are leaving the skin intact and in combination with those deeper structures and lifting all of that as a unit and bringing it back. There's a lot of potential benefit as far as minimal bruising, minimal downtime, and longevity of that operation that has really helped it gain popularity. But what I think has helped it even more is the fact that social media has sort of clung on to the idea of deep plane facelift and even implied that it is a superior operation to other facelifts, and that, you know, people who specialize in facial plastic surgery specifically will only do a deep plane facelift. I think this is a misleading suggestion, and I think that the viewers of this video, if you're considering a facelift, need to understand the difference between a deep plane facelift and more traditional options, and why the facelift as a whole is not a one-size-fits-all operation. So again, I'm going to summarize this pretty quickly. You're going to hear a lot that facelifts should only be performed by board-certified plastic surgeons who are facial specialists. A lot of these are ENT or ear, nose, and throat trained surgeons. But this is an operation that was designed by and perfected by plastic surgeons proper. We that are certified by the American Board of Plastic Surgery, and we are perfectly capable of performing these operations. And so the discrimination between the two specialties is confusing to me. This is one of my passions, and it's something that I excel at, and so I don't think that a board-certified plastic surgeon is any less qualified to perform a facelift than an ENT doctor, let alone one who was further qualified by facial plastic surgery training. I wanted to talk also about the deep plane facelift not being a one-size-fits-all operation. When we perform breast augmentations, we will sometimes put the implant below the muscle. In fact, most of the time we will, but sometimes it's better to put it above the muscle. So if you have somebody with thicker breast tissue, thicker skin, and wants minimal downtime, or they're athletic or something like that, lift weights, and you don't want the risks of putting an implant below the muscle, you put it above the muscle. The same thing goes with facelifts. There's a lot of patients who truly don't require or wouldn't benefit from a true deep plane facelift without elevating some of the soft tissues. Women, for example, with really lax skin on their face really would benefit from what we call a multi-vector facelift that undermines and then redrapes the skin as much or more as the deeper structures. I think if you are minimizing skin undermining and elevation, sometimes you're going to leave a little bit too much laxity, especially in the anterior face. And this really needs to be considered on a case-by-case basis. The other thing is, if you are going to do a deep plane facelift on every single person, you are honestly turning a very bespoke operation, a very artistic and delicate, thoughtful operation into something that's just too regimented, if you ask me. Last but not least, we're going to talk about branding and facelift surgery. I've heard more about this vertical restore facelift by a surgeon in San Diego or a aura lift by surgeons in Beverly Hills, or ponytail lifts. In fact, it's gotten to the point where you really can't offer these procedures as they're copyrighted. This is a branded procedure. And because of that, I've always been thinking of ways to name a procedure that I offer, but it's kind of a hoax to do that, because we always are going to offer patients, I think the best of the facial plastic surgeons at least, will offer patients sort of a bespoke plan. Sometimes we do eyelid surgery, sometimes we don't. Sometimes we need to do a brow lift, sometimes we don't. So everybody's face and everybody's goals differ, and you really have to tailor your plan to that. So to come up with a name for a facelift is just a marketing strategy. It doesn't mean the operation's any different. I think two ponytail lifts could be very different, for example, and a deep plane facelift in one surgeon's practice may be very different than a deep plane facelift in another. On my website, I talk about my unique approach, and the operation that I perform the most on basically all comers, but there are going to be exceptions and there's going to be customization, would be sort of a dual plane facelift. I love some of the benefits of a deep plane facelift, and so all of my facelifts do involve the deep plane. However, I also think skin tailoring and redraping is super critical for not only the jawline but for the mid-face, and that can't be ignored in a lot of patients. So I will usually, I would say for all comers in the average facelift, there is about 75% deep plane benefit and there's about 25% traditional benefit. I work harder to achieve a more subtle result. I don't have a name for my facelift. I don't think you need to be married to the idea of finding a surgeon who could perform a vertical restore facelift or an aura lift or a ponytail lift. You just got to look at the results. You got to talk to your surgeon. You've got to see if your surgeon understands what your unique goals and desires are. If all of this stuff lines up, you have found your match. So I guess in summary, the conclusions I want to make on this video are: don't be fooled by named facelifts. Number 2, natural is always going to be better. Number 3, the deep plane facelift is not a one-size-fits-all operation, and every facelift needs to be tailored accordingly. If this makes sense to you, if this is something you want to discuss with me further, I'd be very, very happy to discuss it with you. I hope I clarify a little bit of confusion in this video, and I most of all hope to meet you soon. Thank you so much for taking the time to watch this. If you have any questions, please leave them in the comments section below, and do not hesitate to subscribe and turn your notifications on. Have a great day.